Hey, and we are back. Thanks for joining me. Thanks for taking your time to come and watch our video. If you haven't subscribed, please hit the subscribe button. And those who have subscribed, I'm saying a very big thank you to you. Thanks for coming back and checking again. Right, still on planning, what we're looking at is the nursing problem or the nursing need. I'll do other videos that has other content, other parameters of the planning, because I'm trying to keep the videos really simple and short. Okay. So if we're looking at the first thing you see is the nursing problem. Some people ask questions like, hey Bella, where can I get the nursing problem or the nursing need? How do I identify it? What do I do? No need to worry. That's why we're here. Okay. Remember, in your assessment station, you are given a scenario. Okay. Now, the scenario has got patient detail at the top, and it's also got presenting complaints, the diagnosis, past medical history, social history, all the medical history, and then the allergies. Now, nursing problem can be gotten from presenting complaints or the diagnosis, most likely. I like to say that we don't always get the nursing problem from past medical history, except certain cases, which are very unique. Okay, so from your assessment sheet or your scenario which is given to you, you can get your nursing problem from your presenting complaints or the diagnosis, most likely. So what's the presenting complaints? Maybe they said the patient came in after a fall. He had fracture of the hip, or neck of femur, something like that. So this is beginning to give us point what the patient's problem is. Or let's say the patient had the fall and he presented with headache, complaint of headache and of pain. Now, it means you can get your nursing problem from there. Okay. Some similar thing you can read in your scenario could be he presented with breathlessness, or they could say shortness of breath on presentation, things like that. I must say that the planning station and getting the nursing problem or the needs is not so difficult. I know some of us still stick with NANDA and all of that. I think for this exam, they've really been an ease. I don't think they really stress on NANDA. They don't use the NANDA because the NANDA is not UK, is the American standard. So it can be so simple and easy to achieve. However, what they're looking for is making sure there is an evidence for your problem. You see, as we go on, you hear how we write that. I'll explain to us how that is done. I'll take us through a bit of that. Okay. Another way we can get the nursing problem in assessment, from assessment station, is when you start to ask certain questions to the patient. For example, you're asking the patient, are you okay? Are you comfortable? Are you in any pain? The key word there, are you in any pain? Let's assume the patient says, oh yes, I've got so much pain. And then you go, oh, where's your pain? Oh, it's just on my back. Oh, can you rate your pain for me on a scale of 0 to 10? 0 being no pain at all, 10 being your worst pain ever. Can you rate your pain for me? She says, oh, it's a 7. Please note that down. Remember, in your assessment, you've got your candidate notes, which you could write setting points for yourself, which is not marked. Okay, note the pain score there because it comes to play in planning. All right. Another way we get the nursing problem or need when we're speaking to a patient in assessment, okay, getting certain information from them, when we start to ask questions. Also, how have you felt? Or how has it made you feel? Is there anything you worry about? You see, that's why you must have this conversation. Let's not go in there scripted with one way, just to ask this question, get your answer and leave. Okay, you want to be able to extract some key things again from the patient. However, please, we need to consider time. Okay, I think I'll have a special video just to talk about time management for the Osce exam, right? So when you do that, when you ask, so how is that making you feel? You know, also they just start to talk. Oh, I'm so scared. I'm so scared. I've had this surgery before, and I got infected, and now I'm going for another surgery. I really don't know what to do. What do you think? You know, so that is beginning to bring up a sign that this patient is presenting with anxiety. Please note that down, because these are things that would help you carry out your planning. Okay? Other things, when you get around in your assessment, look around your patient's surroundings. Sometimes you see them with a walking stick, or you could see it as a frame, a Zimmer frame, depending on what you see. You want to ask, oh, is this yours? Would you like me to keep it aside? Would you like, you know, this will help you know that this patient has got an issue with mobility. All right, so it's all about getting into a station and being very observant, open, and picking all the information we can pick just so we can use it. So once again, where we get our nursing problem from is either from the document in the scenario of the patient's details, where we've got the presenting complaints, the diagnosis, the past medical history, and all of that, depending, right? We could get that from there. We could also get a nursing problem from whatever the patient tells us when we are on our assessment station. Remember, when you get to your assessment station, you'll be given the document from your, when you get to your planning, when you get to your planning station, you'll be given your document from your assessment station. So that will also help you, give you all the details you need as well. I hope I've been able to answer someone's question about how am I able to come up with a nursing problem. If you've got any question or anything seems like, oh, it's not clear, please send in your questions and what you need me to do a video about, or answer your question. All right. In our next video, we'll talk about the aims of care in planning. Okay. Till I come your way, please do make sure you subscribe. Share the video with your friends, with colleagues, with people who you know will need to have this exam done. Share it with them. Make sure they also subscribe. Okay, please click on the like button. I do appreciate all your effort.